Stay free with me, Russell Brand.
Why did you feel it necessary to speak out against some of the measures that took place socially during the period of the pandemic? What was important and significant about it for you?
Well, first let me say that I didn't at first. I bought into it. I was someone that I went through a pretty unique experience in Los Angeles, and was locked down there. I have a nonprofit theater company that had to shutter, and we started doing our work online. And I was masking everywhere. I was keeping my social distance. So I was adhering to the requests made of me. And I felt, angry at people that didn't do that. I felt angry at there was a protest in Orange County, I remember, of people that didn't want to put masks on. Got very angry about that. And as time progressed, I eventually got out of Los Angeles. I drove cross country and saw areas of the country that were not adhering to the policies, and eventually wound up isolating myself in New York State for a good 7 months. And it wasn't until I came to the UK in January of 2021 that I started to have questions. And I was here on a job, and I noticed that people, this was in the midst of the worst part of the lockdown here, and I noticed a lot of people were not adhering, again, to these requests made by their government. And I thought, well, they're going to have a hard day coming up, that there'll be some serious death here. And, I kept my mask on, and I kept adhering to the policies. But it wasn't until much later that I started to have questions. And when I saw that there wasn't a huge death rate here after I'd witnessed personally what was happening, I started to wonder more and more about what we were being told and whether it was true or not. And so it took a while for me to speak about it. I was staying in Soho, and I was there one Saturday morning, and I heard a lot of noise outside. And it was a protest, an anti-lockdown protest. And I went out. I had a bicycle, and I went out, and I joined the protest, not because I was joining the protest, because I was curious about what was going on. And I started talking to people. And I saw the way that they were being described in the press, and it wasn't true. These were not, National Front Nazis. These were liberals and lefties and people that believed in personal freedom. And I began to educate myself, and I began to open my mind to what was going on. It was a very different political environment in the United States, very divisive, very much based on politics. If you were, well, it changed. At first, if you were a Democrat, when Trump was president, well, you weren't going to take that vaccine because it was Trump's vaccine. And then that seemed to somehow change. It was kind of Orwellian. It was like we are no longer at war with East Asia. It was now we were thinking about it a different way. And if you didn't take the vaccine, you were a Republican. And it wasn't that way here in England. There was a much more tolerant attitude towards the diversity of opinion. And so I was really grateful to have been in this experience so that I could get a different perspective.
Perhaps part of your perspective was born of a kind of Swiftian travel, and you would be a good Gulliver because you are a giant in numerous contexts. But because I would say that kind of authoritarianism and the certainty that necessarily accompanies it was present in the media and the state dictates in this country also. What I find interesting, and again, laudable in what you've done, is that you've undertaken your own journey from what was a de facto position of, like, we were told it was a unique health emergency and that the measures undertaken were necessary in order to protect human life. What more noble goal could there be? But as this has unfolded, the position has to be amended. It's become clear that many of the original measures were not as rigidly undergirded as was first claimed. And in fact, as you have explained, there is a lot more political ideology at play than is perhaps wise, prudent, or even honest, when the claim that's being made is that we are following science. That's irrefutable, evidence-based measures. So, Tim, what is, if something like a pandemic becomes politicized to this degree, if conversation becomes shut down, if condemnation of unvaccinated people becomes as sanctioned, like, you know, on CNN when Don Lemon was saying that, you know, these people are idiots and we should shame them, when certain people were saying that they should be denied health care, when Joe Rogan was condemned for sort of having a conversation, it indicates that the climate that we're living in has radically altered. And one of the things that I like to continually reiterate is that nobody here is saying that the vaccines don't have a positive impact or that we oughtn't do everything in our power to protect human life. It's simply that if you have authoritarianism where conversation is shut down, you are losing one of the great treasures, perhaps the primary treasure, of democracy. Do you feel, Tim, that the pandemic revealed something about the nature of establishment power, the aesthetics of establishment power, and perhaps the way that liberalism itself is changing?
Well, I think it started to reveal itself when we became aware of the idea that the vaccinated could spread it and catch it like the unvaccinated. So to continue the policy of lockdowns or mandates after that didn't seem to be following the science. It seemed to be following a political agenda. And so that's where I really started to have problems with it. There were a few instances that were really disturbing to me. One was when I believe it was the CDC or the FDA changed the definition of a vaccine on their website. Another was that when they denied that natural immunity was something. So there was an awful lot of people that got COVID early on. I believe I did in February of 2020. I was in Seattle on tour with Play, with the Actors Gang, and I got very sick. And in the past, natural immunity is one of the building blocks to moving forward. Some people get vaccinated, some people have natural immunity, and eventually we have, what do they call that?
Herd immunity.
Herd immunity. So the fact that there were these change of definitions was something that my alarm bells went off. And so I wondered what is going on, what is beyond the very real idea of taking care of people and making sure that we don't have a terrible death rate. But then we also became aware that the most people at risk were either immunocompromised or elderly. And then when you consider that the WHO, the World Health Organization, changed its protocol on virus outbreaks, which in the past had been you lock down the vulnerable, you take care of them, you make sure they're taken care of, but you let society go on so that it can build its herd immunity. This was changed as well. We went into lockdown with healthy people and with children, and that didn't seem to be wise to me. So I'm not a scientist. I'm not a doctor. I don't know the intricacies of data on this. All I can respond to is as someone that has is concerned about what the result of those doctrines, that policy had on us as human beings. And it's not good. We turned into tribal, angry, vengeful people. And I don't think that's something that is sustainable for the earth, that we start demonizing people that don't agree with our particular health policies and turn them into monsters, turn them into pariahs, say that they don't deserve a hospital bed. I think about, people that have made bad mistakes in their lives where they take too many drugs and they overdose, and that's totally their choice. That's totally their responsibility. Yet we take care of them. Yet we bring them to the hospital. Yet we save their lives because we're compassionate, because we want to make sure that people live. And this turned. It turned into, you should fucking die because you have not complied. That's incredibly dangerous.
Watch entire episodes on demand for free at rumble.com/Russell Brand.